Welcome to CPT Coding Guidelines Review, Moderate Sedation. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding for the provision of moderate sedation. So, before we dive into the guidelines themselves, let's take a quick look at what moderate sedation is. Moderate sedation, also known as conscious sedation, is a drug-induced depression of consciousness, during which patients respond purposefully to verbal commands, either alone or accompanied by light tactile stimulation. During moderate sedation, no interventions are necessary to maintain cardiovascular function or airway patency, and spontaneous ventilation is adequate. If you're interested in learning more about the levels of procedural sedation, visit the website at the URL shown here. Moderate sedation services are reported with codes 99151 to 99157. These codes are not used to report administration of medication for pain control, provision of minimal or deep sedation, or monitored anesthesia care. For the purposes of reporting, intra-service time is used to select the appropriate moderate sedation codes. Moderate sedation codes 99151 to 99157 include pre-service work that is not separately reportable, and it is not included when calculating intra-service time. The following activities are considered pre-service work: assessment of the patient's past medical and surgical history with an emphasis on cardiovascular, pulmonary, airway, or neurological conditions, review of a patient's previous experience with anesthesia and/or sedation, review of a patient's family history of sedation complications, summarization of the patient's current medication list, and review for a history of drug allergy or intolerance, and review of any pre-sedation diagnostic tests. Pre-service work also includes a focused physical exam with emphasis on the mouth, jaw, oropharynx, neck, and airway for determination of a Mallampati score, a medical classification system used to assess the visibility of the oropharyngeal structures to predict potential difficulty of intubation or airway obstruction, and emphasis on the chest and lungs and heart and circulation. Assessment of vital signs, including heart rate, respiratory rate, blood pressure, and oxygenation, with end tidal CO2 when indicated. Completion of a pre-sedation assessment form and patient-informed consent. Immediate pre-sedation assessment prior to the first dose of sedation agent and initiation of IV access and fluids to maintain patency. Intra-service time is used to determine the appropriate CPT code to report moderate sedation services. Intra-service work begins with administration of the sedating agent and requires continuous face-to-face attendance of the physician or other qualified healthcare professional. Intra-service time ends when the procedure is completed, the patient is stable for recovery, and the clinician providing the sedation service ends personal face-to-face time with the patient. Intra-service work includes ordering and/or administering the initial and subsequent doses of sedating agents. Intra-service work also requires monitoring of the patient's response to the sedating agents, including periodic assessment of the patient, administration of other agents as needed to maintain sedation, and monitoring of oxygen saturation, heart rate, and blood pressure. If the physician or other qualified healthcare professional is performing the procedure, as well as providing the sedation service, they will supervise and direct an independent trained observer who has no other duties during the procedure and will assist in monitoring the patient's level of consciousness and physiological status. Post-service activities are also included in the work reported by codes 99151 to 99157. These activities are not separately reportable and are not used to select a CPT code, and are not assigned with codes 94760, 94761, and 94762, which are the codes for non-invasive ear or pulse oximetry for measuring oxygen saturation. Once continuous face-to-face time has ended, any additional face-to-face time is not added to the intra-service time and is considered part of the post-service work. Post-service work includes assessment of the patient's vital signs, level of consciousness, and neurological, cardiovascular, and pulmonary stability in the post-sedation recovery period, assessment of the patient's readiness for discharge, preparation of documentation regarding sedation services, and communication with the patient's family or caregiver regarding sedation services. When selecting codes for intra-service work, codes are assigned for provision of services in 15-minute increments. Codes for intra-service work are selected based on the age of the patient and whether the physician or other qualified healthcare professional is performing the procedure and providing the sedation, or just providing the sedation service. Codes 99151, 99152, 99155, and 99156 are primary service codes assigned for the first 15 minutes of intra-service work. Codes 99153 and 99157 are add-on codes, reported in conjunction with a primary code to report an additional 15 minutes of intra-service time. CPT uses ranges of time to determine how many increments of 15 minutes should be reported for intra-service time. Reportable increments of time are computed based on the following. You can refer to the table in CPT for an exact accounting of which codes and numbers of regular and add-on units are associated with each time range. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review Series, as well as our full catalog of courses at hialearn.com.